Let's do it. So let's talk about why American healthcare is so outrageously expensive. Did you know that medical debt is the #1 cause of bankruptcy in the United States? The fact is, we're the only industrialized nation in the entire world that doesn't provide socialized or universal healthcare. But despite what politicians who are funded by private insurance companies might tell you, American healthcare is not a free market. You may have noticed that it's actually impossible to find out what your healthcare will cost before you get it, which makes it impossible to negotiate or comparison shop. Your healthcare cost is actually determined in a negotiation between your insurance company and your healthcare provider, both of which are for-profit organizations with no competition, transparency, or incentive to make healthcare affordable. And that's because the foundation of privatized healthcare is that people are willing to pay literally any amount of money to not die, so providers of medical services can charge literally any amount of money. For the simple reason that healthcare is obviously not a commodity, it's a basic human right, and arguably one of the most fundamental. Now, in countries that do have socialized healthcare, prices are low because the government is the only reliable buyer of medical services, and they negotiate with hospitals and pharmaceutical companies who do actually have to compete to provide the lowest cost at the highest quality. But at least the quality of healthcare in the US is super high because of how expensive it is, right? No. America has the worst healthcare outcomes among all high-income industrialized nations. We are dead last in almost every single metric, and that's the biggest reason healthcare is so expensive. But there are other interesting reasons. Check out part 2.